Good evening, everyone. My name is Robert Stevenson. It is 5:31, and I'm going to call to order the special meeting for the Southwick Tolland Granville Regional School District School Committee. This is a special meeting tonight. We basically have one item up for discussion. We're going to be listening to public comment for a period of time, and then we'll be, as a committee, looking at coming up with an action item to either have all the students wear a mask or follow the DESE guidance. Under the public comment, I just want to kind of set some rules of conduct here tonight for everybody. Under public comment, the policy that the school board has is we normally have this for 15 minutes. The chair has the ability to extend that time. I've already decided that we'll do this up to at least 30 minutes. Ideally, we want to get 10 people at least, if there are 10 that want to provide a public comment. We are going to try to adhere to the 3-minute limit. Amy is going to be keeping track of the time. She has a little red paddle there. When we get to like 2 minutes and 50 seconds, or she's just going to raise it up to give you a visual warning that your time is up. I'm going to ask you to respect the time of everybody here in the committee. Wrap up your comment at that point. I would hate to have to cut anybody off, but we can't have anybody up for 4, 5, 6, 7 minutes having a on the public comment. I want everybody to be respectful of everybody's opinion. It is not a debate. We are looking and giving an opportunity for you as the public to give us some information and let us know your opinions. Please don't have any sort of challenges in the audience. We want to be respectful of everyone. Other than that, I think we're ready to start. We are recording tonight, and we want to make sure that if there is somebody who will be recording, we need to know that with your name and address. And if anybody could say that right now, that'd be fantastic. Thank you very much. So, public comment. So at this point, if you could raise if somebody wants to come up and speak, I'll acknowledge you. You come up to the podium. You can start. Amy will start your 3 minutes. And then the goal is for us to get through 10 people, and then I'll sort of take a break and we'll see where we stand. That's how we're going to proceed. So anyone want to come up first? Yes.
That's what I'm showing you. That's not the national.
Yes, ma'am.
Hi, my name is Jen Belden.
yeah.
I have 8 North Long Yard Road.
I'm sorry, can you repeat your name?
8. I'm sorry, Jen Belden, 8 North Long Yard Road. So I have 4 kids. They are all under the age of 12. And the 3 of them that are in school want to come back more than anything. They want to be here. And I don't want that to not happen because we don't put a mask policy into. I think it's really important for these kids that can't get vaccinated yet to make this happen. I am a teacher in another school district. We have a mask policy in effect. Not a problem. The students that I work with and that I worked with over the summer, we're happy to oblige to be there. They want to be in school. So let's do this, please, for these kids. Thank you.
Thank you. Yes, ma'am, in the 3rd row.
Sarah Kaminsky. I'm at 8 Great Brook Drive. I'm new to the district this year. We left West Springfield after some issues with the school district and our family. I am immunocompromised myself. I am a type 1 diabetic. And we have issues staying completely healthy. That said, prior to COVID starting, we have always been responsible for our own health. We have always been in trouble for keeping our kids home when we needed to. We have had DCF call on us for being sick, with doctor's notes, with phone calls, with emails. And maybe that's not the way it works here, but in West Springfield is where we were for 10 years. I volunteered at all of the things. I went on all the field trips. But we've always been responsible for our own health. Nobody cared about us prior to this happening. And I've never expected anything different. I don't need anybody to make choices for my health. I don't need anybody to make choices for my daughter's health. We have the ability to wash our own hands, keep our own selves clean, and deal with the things as they come, as we always have. My daughter is, my oldest in the school district will be in 7th grade. She tries at home to wear a mask. She gets about an hour and a half. When she gets anxious, her blood sugar tanks. That's about as far as she gets. And she can't come back to school if she has to wear a mask. We homeschooled last year specifically because we couldn't make it work. We couldn't do remote learning because they went from the top of their classes to just awful headaches, anxiety, stress, working from 8 in the morning till 5 at night. So we homeschooled last year. And that was cool for me. I loved it. But the older kids really want to come back, and we can't do that with a mask mandate. And we don't expect people to set their children on fire to keep ours warm. Like people should keep their kids home when they're sick, like they should be, like it should always be. And that's prior to COVID. Flu almost killed my daughter a couple of years ago, and we dealt with it as it came. And it's crazy to me that this is now, everybody's like, well, what about those that are immunocompromised? It never mattered before. So we disagree 100% with the mask mandate. I know you guys probably have your minds made up, but whatever side of the aisle you're on, but it's also crazy. There's other places that have parental choice. There's places that had no mask mandate the whole time.
You can finish up.
No mask mandate the whole time. And those districts weren't any higher in their numbers. And so that's it.
Thank you very much. All the way in the back?
Nicole Apostle, 26 Laurel Ridge Road. I'm just wondering what the plan is for people who have children with health risks that are afraid for their children and that aren't willing to just let them go and roll the dice. I know a lot of people that are. There was a little girl in my daughter's class last year who has cystic fibrosis. That is absolutely not something that you want to get coronavirus with. She was home all last year for that reason. We have a right to protect our kids, and it seems reckless to me to say, well, we're okay with it. We're going to take that risk. Your children shouldn't be put in risk knowingly. And I don't think any doctor would agree. And we do know that masks help reduce the spread of coronavirus. Look at Florida. They don't want to vaccinate. They don't want to mask. They are on fire, as well as many other states right now. And we are those states here in Hampden County. So we need to be very careful, because wearing a mask when you're sick keeps you from spraying and aerosolizing droplets of your own saliva. When kids sneeze, they're not containing anything. When they're coughing, it's all over whoever's next to them. And you can have coronavirus and spread it without having a single symptom. And that is what's troubling. As well as the fact that we know that parents will send their kids to school when they know they're sick, because some people don't take it very seriously. So what we need to do is protect our children through this minor inconvenience. And if there are kids who have these physical ailments that prevent them from wearing masks, they're the reason that everyone else needs to, so that they don't have to. Children who have physical reactions to a mask are the very severe minority. That is not common. And their doctor could provide evidence that is true, and they should be accommodated. They shouldn't have to wear a mask, but everyone else who can should, to protect them. I keep likening this in my head to drunk driving. Well, I want to, and I'm okay with the risk of hitting a tree. Well, it doesn't make it okay for you to risk other people's safety just for your own convenience and comfort. We have to take care of each other. And I don't know what we're teaching our kids if we say that this is too big of a deal. People all over the world look at us like we're crazy because it's not a big deal. We're all adults. I have a massive zit under here, wearing a mask, 8 to 10 hours a day, but do I care? No, I think it's a small price to pay to keep my kids who are too young to be vaccinated healthy. That's all.
Thank you. Yes, ma'am.
I know I'm gonna run over already, so get the card ready. I apologize. My name is Bonnie Wally, 16 Cheap Pasture Road. I taught in the school district for 27 years. 5 of my 7 grandchildren are currently enrolled in our schools, ranging from kindergarten through grade 12. 2 of them are vaccinated against COVID and 4 are still too young. They are relying on this school board and the community to protect them. And with the surge of the Delta variant and the fact that yesterday Southwick officially re-entered the moderate risk category, I feel it is in the best interest of all the students and the community's health and safety to implement a mask mandate. I would like to offer several medical experts' opinions on the best practices for controlling the spread of COVID. Dr. Christopher Polino, who is my son-in-law, is an infectious disease physician who has been treating COVID patients since March 2020. He works with Dr. Stephen Thomas, who is his boss. He's the interim chair of microbiology and immunology at SUNY Upstate and professor of medicine. Dr. Thomas was selected by the governor of New York as the regional leader in central New York, providing guidance for both hospitals and schools. He's been on CNN. He's had articles in Forbes magazine. Recently, he stated, our main goal should always be to provide our children and their families the best chance at having in-person learning and extracurricular activities for the entire academic year. 3 main points that he felt would prevent schools from reaching this goal were the low vaccination rates. Half the country is not fully vaccinated. Only 30 to 40% of the 12 to 18-year-olds are vaccinated, and children under 12, of course, can't be vaccinated yet. The Delta variant is more infectious to all age groups, even those that are vaccinated. Dr. Thomas noted that in previous strains, 1 person typically infected 2 people. Today with the Delta variant, 1 person infects an average of 8 people. Health Director Tammy Spencer said, if the children who have been getting infected have been experiencing more symptoms than those that had the original COVID-19 virus, and is believed to cause more significant symptoms in children. The third point that Dr. Thomas mentions is there's a failure to recognize the current risk of COVID to the children. Last week, 15% of all infections in the United States were in children. That's over 100,000 children total. Today, over 1,800 children are hospitalized in ICUs. The hospital beds in the South are totally consumed. There seems to be a misconception that children cannot die. Over 400 children have already died from COVID. What can we do to help the children and the staff to promote learning best? The CDC recommends vaccination nationwide, and beyond that, masking indoors. Masks are safe and they work if everyone wears them. They decrease particles you breathe in, but more importantly, the masks catch what you breathe out so others don't inhale your germs. A mask is very low risk intervention with high level benefit, preventing large number of children from becoming infected and schools being forced to shut down. If I can, in closing, I'd just like to I am reminded of students in my own classroom in the years past who suffered from peanut allergies. The entire school staff took special precautions to protect all these children with peanut allergies and ensure their safety. What we face today is absolutely no different. We have students of all ages in our classrooms who suffer from respiratory illnesses or are otherwise immunocompromised and who are just as susceptible to death or severe reactions due to COVID. Thank you.
Thank you very much. Yes, ma'am.
Amy Pomeroy, 57 Will Palmer Road. As a parent and a teacher, I strongly believe that students want and need to be in the classroom every day with their teachers engaging them in active learning. The way to ensure a student has the greatest opportunity to have this happen is to have universal mask mandate. Instead of creating an environment where there are 2 groups of individuals, the masked and the unmasked, we should be creating an environment that encourages all students to wear a mask, protect each other, and to keep all students in the classroom safe. I haven't surveyed students, however, in working with them for 20 years and having 2 of my own, along with 11 nieces and nephews, I can confidently say that given the choice between having normal school in person with masks or risking having a quarantine, shut down the school, or worse, causing a classmate or teacher to get very sick, they choose the mask. Students did remarkably well the last few months of school last year wearing their masks and were given plenty of mask breaks outside where they could socialize and see each other's faces. Some students didn't even remove their masks during the mask breaks, saying they forgot that they were even wearing them. DESE and Governor Baker have both stated that they expect school districts to do what's right and require masks for unvaccinated individuals. DESE has laid out a quarantine guidelines that require 6 feet of distancing to be considered a close contact while maskless. But there's an exception that changes the measure to 3 feet in the classroom if parties are masked. I don't know if you realize that this changes the number of potential close contacts needed to quarantine if exposed from each by close to double, which will mean that many more students potentially be sent home. As a high school mathematics teacher, I can tell you that multiple absences are hard to catch up on. From there is no alternative plan that I am aware of for those in quarantine to receive instruction. I assume teachers will just be sending home packets of work. After the backlash last year, where schools were forced to go to remote, I would think that we'd be doing everything we can to keep schools open and avoid kids being sent home with disruptions to their education. From a parent's perspective, I'm extremely concerned that our school district would even consider not providing my children with the most protection possible against the Delta variant. My son is not old enough to be vaccinated. I chose remote learning for both of my children last year because I didn't want them to be part of the guinea pig process of determining if the policies laid out by DESE would work. I did not have a choice for myself to stay home, however. I felt I had more control over my environment as an adult than my children did. As the year went on, it seemed more evident that if masking and distancing requirements were followed, they were effective. However, my kids did decide to remain remote. Fast forward to now, and as a parent, I no longer have that choice to choose remote learning for my kids. There is a more contagious variant that is affecting kids more than the original virus, according to the health director, Tammy Spencer, and other research. And now there is a consideration to allow students to be unmasked while sitting in classroom all day with my son, who cannot be vaccinated yet. I understand that he can wear a mask, and he will. However, if his classmate comes to school with COVID and is unmasked, my son's chances of getting COVID is greater. And the more kids without masks, the more risk he has. I know peer pressure is going to be a factor, and the teachers being responsible for mandating that some kids wear a mask and some don't in the classroom seems unreasonable. Wrapping up, what happens if the child contracts a severe case of COVID in our district and decide to go against the recommendations of the Massachusetts Association of School Committees, DESE, the American Academy of Pediatrics, the CDC, the Massachusetts Teachers Association, the Massachusetts Department of Public Health, and the Massachusetts Medical Society, and allow families to decide on masking? It seems like a risk our district should not take. Please make the right choice and vote to keep our students and staff healthy in school. I am looking forward to another great school year, and I want my focus to be on educating my students without the worry about myself, my children, my students, or my coworkers getting sick.
Thank you very much. Anyone else? Oh, in the back. Yes, ma'am. A group, I just want to clarify, group, or
Yeah, they're my moral support.
oh, okay, no, that's fine. That's,
Oh,
So they're just close to me, but if they won't speak out, they'll speak for 3
we don't bite.
Okay. I'm Terry Portenstein. I live in Westfield 117 Wildflower Circle, but I teach here at Powder Mill.
As do both of us.
Yes, they're both teachers here at Powder Mill as well. We all taught last year through the pandemic. We were all fully in person until we were forced to go remote in November and came back in February. And so we went through all the mandates of wearing our masks and taking the mask breaks and whatever else. We feel at this point that if you're vaccinated, and I know students can't be vaccinated at our school because they're too young, but if everyone is thinks that the masks are so effective that if you all wear one, we won't get it, then if you feel you need to wear one, you wear one and you don't have a chance of getting COVID if you're wearing a mask. If we're saying masks are going to keep us safe, then the people who want to wear a mask will wear a mask and they'll be safe. That's the point I just don't seem to get. So if I'm vaccinated and and I feel okay not wearing a mask, I feel that I shouldn't have to wear a mask, because if someone else doesn't feel safe, they will wear a mask, and that mask will protect them. Because we're saying masks will protect us. So I just don't understand why we're making other kids who don't want to have to wear a mask. And I had lots of kids. I teach 9 and 10-year-olds. They didn't like to wear the mask. I mean, yes, they wore one because they were in school. Half of them are down below their noses. We're constantly telling them to put them up. Then the end of the year, we're outside, playing outside. Oh, it's okay not to have it outside. It's fine. You can be this close outside. But as soon as you get back inside, make sure that mask is on. I mean, kids were saying, well, this makes no sense. Especially at the end of the year when everything else was opened up. They're going to grocery stores and to trampoline parks and spending nights at their friend's house and seeing people outside of school without a mask, yet they're coming to school and they have to wear a mask. And we're not taking into consideration the social, emotional effects that masks have on children. They're not seeing their teacher's face. They're not seeing their friends' faces. I feel like we're not taking that into consideration. And yes, the Delta variant, I agree, they're saying is more spreadable than the first one was. But again, people who can get a vaccine are getting vaccinated, and people who feel unsafe are wearing a mask. I really hope that I don't have to go through another year. I don't know how many of you here, I know there are teachers here, but I don't know how many other people are here that have to work in a building with no air conditioning and wear a mask for 6 hours a day. I just don't know if there's anybody else who has to do that. Yes, I know there are teachers here, but other people who are making the decisions, I mean, are probably not doing that. And it's very, very hot in the beginning of the year, and to have that, wear that mask, and as a teacher to have to speak out loud with the mask on all the time is very challenging, and it's challenging for the kids. So I just hope you consider not just, you know, the people who really want to wear a mask. I feel like if you have people who want to wear a mask, they can wear a mask and they will feel safe. And those of us who don't won't have to wear it. Thank you.
Thank you very much. Yes, sir.
Hi, my name is Joseph Sloboda, live at 43 Congamon Road. I'm not a big fan of public speaking, but I feel moved that I need to say something here. As a parent of a child who's not old enough to be vaccinated yet, and as a microbiologist for over 20 years at Bay State, I'm horrified at some of the opinions. I have spoken to Dr. Armando Paez. I tried to get him to come here tonight, but as the head of infectious disease at Bay State, he's a little busy with the pandemic. He did give me some links, including the science of masking directly from the CDC website about how masks work on both the person who's exposing and the person who's being exposed. I also spoke to Dr. Christine McKiernan, the Division of Chief of Pediatrics for Critical Care at Bay State. She gave me a lovely thing that she held a local board of health with their local mask mandating, which they went ahead and did. I am not at liberty to say what town it was, but it was in Hampshire. Bay State on 8/17 had 48 COVID cases, 5 in ICU. On 8/18, 52 COVID cases, 4 in ICU. Today, 58 cases in the hospital, 5 in ICU. Local towns of Northampton, Longmeadow, Westfield, Springfield, Amherst Pelham, East Hampton, Granby, Munson, Chicopee, Holyoke have all gone with a mask mandate. I found very interesting at the other end of the state, Bill Rickomass split it up so that grades 1 through 6, all the children that aren't old enough to be vaccinated will be masked. High school, they're leaving it up to personal choice. I think that's a very good idea. And I'm just going to wrap. They did an interview with Baker on GBH radio Wednesday night. This is a direct quote from him. Based on what we've heard from our colleagues in local government, virtually every K through 6 student in Massachusetts will be masked. Evidently, he doesn't go to Western Mass. And we also believe that virtually every unvaccinated 12 to 19-year-old will be masked as well. Well, we heard from the DPH nurse for this local area on Monday night how well our vaccination rate is. Oh, and to add to that, the entire state of Connecticut is following the mask mandate. All right, I'm going to wrap it up. I'm going to close it up with a quote from Eleanor Roosevelt. freedom, which everybody is tossing around, it's my right not to wear a mask. Okay, fine. You know, freedom, and this is from Eleanor Roosevelt, freedom makes a huge requirement of every human being. With freedom comes responsibility. For the person who is unwilling to grow up, the person who does not want to carry his own weight, this is a frightening prospect. And the fact that we are discussing this as much as we are, I find frightening and very disheartening as a microbiologist. Thank you.
Thank you. Anyone else? Yes, sir.
Dave Spina, 7 Grapefruit Drive. I think it's important to consider that this is not a question about convenience or anything like that. Now, as was discussed at the meeting last time, masks, cloth masks have limited ability to really prevent the spread of COVID. You have a fitted N95 mask, that's going to prevent virus particles from getting either in or out. Regular mask, yes, if you're maybe sneezing, it'll prevent some particulates from getting out, but that's what social distancing is for. I think really what this is a question is not convenience, but rather risks and benefits of the masks. Now, I don't expect the average parent of the average typical kid to understand what having a mask on will have for that special kid who it's a real problem for. I don't expect them to understand that, and that's okay. But the parents who do have that kid who's going to be challenged by a mask for whatever the reason might be, whether it's for sensory issues, some other health issues, as we were talking, sensitivity to bacteria being re-inhaled, etc. Those parents of those specific children, they're going to fully know truly what that risk benefit really is for them. And that's why I'm a firm believer that they are the best ones to be able to make the decision about whether the mask is right for their child or not. And that's why it should not be mandated. It should be left up to the children, to the parents of those children for the desk guidance. Thank you.
Thank you. Yes, ma'am.
Hi, I'm Ina Ukrainis. I live in Southgrass Lane in Southwick. I am new to the town, so I have 2 children, 3 and 5. Young children are not affected by this virus. We are forced to put the mask on our children. This is affecting their emotional, mental, physical, and psychological health. How does this make sense? All summer long, children were not wearing a mask, and now when they come to school, they are mandated to wear a mask. This is child abuse. No kids should be forced to wear a mask. Sorry. 25% of their suicide rate from 2019 because of social isolation. Children need social interaction, and where they see that there are the proper techniques from the teacher so they don't get behind. We as the community need to do what's right for the children. Thank you.
Yeah. Okay.
Stephanie Nagella, 3 Do-It Circle. Dear school committee members, I urge you to vote for a mask mandate for our district. Masks help prevent the spread of germs and slow the spread of illness. Masks are also a visual reminder to our students that we are in a pandemic. It reminds our students to be mindful of social distancing. It reminds them to do proper hand washing. Would I love for my daughter's first day of kindergarten to not include a picture of her wearing a mask? Yes. But I also am hopeful that the picture of the last day of school in June will be a happy picture, knowing of how great this past year would have been. I urge you school committee members to do everything in your power to help ensure that my daughter has a safe in-person school year. DESE uses the language, highly recommends mask wearing. It does not use the language, give parents the choice. There is a reason for that. DESE is highly recommending that school committee members create a policy for masks in our schools. As a teacher in this district, I can personally tell you that wearing a mask was the easier part of last year. The students embraced the new look and didn't complain about the mask. But the things that were hard for the students and myself were the 11 weeks that we were remote learning. Comforting a student that would need to quarantine because of being a close contact. And finding out that a student had tested positive with COVID. It is not just the parents. Well, sorry. By not mandating a mask policy, those hard moments of last year will become a reality sooner than we would like. As a parent and a teacher, I want this school year to be as safe as possible. I'm asking you to please put into place the mandate of a mask policy like so many other districts in Western Mass have been doing. Thank you.
Thank you. So we've had our 10 30-minute time frame that I originally set up. I'm certainly willing to extend that a little bit if there's new information, different information that we haven't been presented with at this point. We have, just to let everybody know, we've received 8 to 12 different emails from people in the community. 19 emails from the community. We had comment on Monday evening at our meeting, and we've now had another 30 minutes. Is there anybody that has anything new that we haven't heard for? Okay, and that I'm gonna let you go up first. I see Rose in the back, and
I'm at St. John's, 22 Deer Run. As you all know, or some of you don't really know my face from the Zoom, but I was the student advisor last year on the school committee. As I also helped design the 2020 COVID renewed handbook with Mr. Pascatelli last year. I went hybrid. I was on the sports teams. I did everything. I wore my mask in school. I followed all guidelines. But also, I was one of the first in-person students to get vaccinated. I was one of the people that got one of the leftover doses at CVS just because I wanted to be vaccinated so bad. I was super anxious about COVID, always wore my mask, always wash my hands. But now I feel safer. I've never gotten COVID because I wear my mask when I need to. I wash my hands. I use the hand sanitizer. I take all of my precautions. Good. At work, it's my choice. I don't wear a mask, but I'm safe with what I do. And I know other students that are vaccinated and that will be safe too. So I think that it definitely should be considered about the older students that are vaccinated should have somewhat of a choice. I'm going to be 18 next month, and frankly, I don't really want to be wearing a mask my senior year, especially because I've been vaccinated since March, and it's just, I haven't been wearing a mask, and I don't really want to. I miss seeing all my friends' faces. So many of my friends are vaccinated. We've been hanging out all summer. I think even for some teachers, if they're vaccinated, I miss seeing their faces. It's hard when they're teaching, and I can't see their facial expressions. Sometimes I don't know what the subject's on. I really get lost in the conversation sometimes because of the masks. Even for the younger kids, especially for the younger kids, I can't speak on the younger kids wearing a mask, but I know teachers, it's hard learning as a student when you can't see the teacher. You can't see what they're talking about. Facial expressions is so much, especially for the young ones. So I feel bad for the young students that can't understand a teacher teaching them a new emotion. Sorry. That's pretty much what I have to say. I've kind of been stuck through it all, listening to all the opinions. I just think that if someone's vaccinated and they want to choose not to wear a mask, I think that that is okay. Thank you.
thank you. Mr. Quinn, did I see you have your hand up?
Rich Quinn, One Hunter's Ridge Circle. So I think all of you know who I am. Those of you who don't, I am a high school performing arts teacher. I teach band, chorus, and drama. The worst thing about this whole process was teaching remote performing arts, band, chorus, and drama. My mindset, I have a couple of points to make. One related more to my profession, and the other one related more to some concerns as a parent. From a selfish professional standpoint, I want to make the choice that we don't have to shut down and quarantine a classroom. And right now, based on what I've been looking at for guidelines, if we have to wear a mask and be 3 feet apart, and if someone comes down with COVID, God forbid, in any classroom, we don't have to quarantine that room. I may have read that wrong, but that is how I interpreted it. I don't want to shut it down. We talk about a lot, or at least I hear a lot about learning lost and what is lost. I make an argument that my students have lost the most during this pandemic. Day 1 of 2020 quarantine was my Pops concert. I can't tell you how many emails I got from kids so upset about that, trying to make me undo a global pandemic. 2 weeks after that was the opening of my musical Newsies that I spent 4 months working on, and $6,000, and that was gone. I want to have my kids in person. I never want to do hybrid or remote again. I will do it if I have to, but man, would it be so nice to know that if we just throw this stupid piece of cloth on our face, because I'll admit, I hate them. If that's what it takes just to keep us open, what are we doing here? Keep us open. I mean, I understand there's underlying circumstances. A lot of people brought that up, but this seems to be the simple solution. From a parent standpoint, if we do have to go into remote learning, or if we do have these kids that just simply can't be in school for health concerns or health reasons or SEL reasons, we don't have, I don't know if there's a plan put in place yet. Is there a plan put in place? And to me, it seems like that could be something that's taken care of, but we're trying to get over this one hurdle. And for me, it's let's keep the schools open, guys. Like why make this, I understand the visceral reactions here, but my visceral reaction is let's get in the building and teach. Let's work out, if people have individual issues with it, we can deal with it that way, but let's start with a blanket statement and move on. I want to be in school. I want to do concerts again. I haven't done any performance thing with my students in person with people other than graduation this year because it was outside. And that's all I have to say about it. So thank you.
Thank you very much. Mrs. Hannah, I saw your hand up.
Thank you for the extra time. My name is Rose Hanna. I live at 18 Laurel Ridge Road. Essentially, I have a 2021 graduate. We observed the science of all throughout the year. She experienced a great deal of loss. She was an honor student. She's received a lot of awards that she wasn't able to attend. She won Girls State. She won the Rotary Club. She qualified to attend the Naval Academy Summer Seminar at Annapolis. All this was shut down. In addition to this, there was no prom junior year. There was no mock trial at the federal court. There were no sports. There was no senior. There was no senior prom unless you consider a dinner at Roma's in a $400 couture gown, a prom. I don't. She was an essential worker at our local Big Y, where she serviced customers from Massachusetts and Connecticut as an essential worker. She could go to work, but she couldn't go to any of these other functions. My issue with this mandate or intended mandate is the language that involves the parent's right to choose. My career is in law, studied the law, and I fundamentally look at that statement as very concerning. When you hand over your rights as a parent to a governing body to choose what is best for your child in the name of science, a science that refuses to recognize natural immunity and requires a vaccine, people who have the best immunity to this virus, that's where I have a problem. So if you want to wear a mask, wear a mask. If you don't want to wear a mask,
don't get into the bullying aspect of it, because you think that you're safer in a piece of cloth that likely came with a warning that it's not going to protect you from a viral load, as well as an N95 mask, which still allows in 5%. And you may want to consider some goggles on those mucus membranes to help protect you as well. That's all I have.
Thank you. All right, last one. Come on up in the second to last row. Okay.
Hello again, back from Monday night. Nicole Burnt, 286 Granby Road, Granville, Mass. Here we are again. I have no desire to go rehash with all of you our abysmal vaccine numbers in this county, as well as our 3 member communities, as well as individual populations in school. I don't want to debate facts and science up here because there's really nothing to debate. The one issue that this seems to keep coming back to as far as debate is choice of parents. And I get that. But I think the thing that everybody is missing is, unless we are going to mandate our teachers to keep a list in their classrooms of, okay, Janie's mom says that she has to wear a mask at all times, indoors, outdoors, in the cafeteria. She has to sit by herself and eat her lunch. Jimmy's mom doesn't even want him to look at a mask. You know, Bobby's mom says he has to wear it inside, but he doesn't have to wear it outside. And Taylor's mom says it's Taylor's choice. Unless we are going to task our educators, who are already have had the worst couple of years here that you can imagine, with this completely unreasonable thing, you are not giving this choice to parents. You are leaving this choice with children. That makes it the student's choice if they're going to wear a mask or not. This is why we have public safety laws. Do I agree with our seatbelt rules? Not especially, because if you get in a car accident, you don't have a seatbelt on, that's your choice. You're hurting yourself. And that's a fairly new law in Massachusetts. But we have always had a law that protected our kids and mandated seatbelts for our kids, because we need to make sure our kids are safe. We're not leaving that choice in their hands. So it's the same thing with smoking in restaurants. You used to be able to do that. Now you don't have the freedom to do that anymore. Why? Because it affects public health. You can go outside and smoke. If you're over 18, you're welcome to do that. But you can't smoke inside a building anymore and affect the health of other people, particularly children. That's why they're talking about making laws about being able to smoke in a car with a minor. You are leaving this choice in kids' hands unless we are going to go down the unreasonable road of making sure teachers know each individual parent's preference and spends their day enforcing that. I'm good.
Thank you very much.
I've talked about this for 18 months and I'm tired. I sit on the Board of Health in Granville. This is exhausting. And I've battled this for too long. I want to give this time back to my family.
Thank you very much. One more. All right, last one. Oh, if it's quick, then that's really good. It's kind of like 14A then. It's not really 15.
When you wait till the end, everyone says everything else.
Okay.
Chelsea Berry, 106 Coast Hill Road. I was a teacher throughout the pandemic, parent throughout the pandemic. You would have loved to watch what happened in my house when my kid was stuck home. Not good. Not good at all. I get it. Like, I understand all that. I cannot have my kids stuck home again. Cannot. My question is, whatever policy is put in place. It sounds like there's some creative alternatives, some things to really think about. What happens when Susie comes in and she is actually in school for like 2 days before she finds out that she got COVID at her grandparents' house, like over Thanksgiving break, and now she's played with every single kid, close contact in that room. Are they all going home? Again. How are we keeping track of individual needs for masking? Are my teachers and my administrators in this district, are they going to be now babysitting masks? I'm really concerned about that. I want our focus to be on being in school, learning, being together. If the numbers say we don't need masks, if the numbers say like, hey, this pandemic's going away, take them off. Like, let's have a burning party. But right now, they're high. I know a ton of people who all just got sick and it didn't end well. They're one of those numbers that we just listed off. That's why I'm wearing a mask today. Like, it's not good right now. It was good, but for some reason the numbers are spiking, and so we need to be responsive to that right now. And we need to think about logistics. What happens when? If we don't have our masks on, what happens when? And am I going to end up with a bunch of classrooms getting sent home? Because we cannot have that. That's what leads to depression. That's what leads to isolation. That's what we cannot have. Thanks.
Thank you. Okay, thank you, everybody, for your comments. We really do appreciate them. So we're gonna go on to action items. So basically, as we talked about on Monday, the two that we've discussed, which there may be more that comes up, we're looking at one option, potentially instituting a mask where everybody would wear a mask at school. The other one would be to follow DESE's recommendations that everybody wear masks. So those are the two that we had talked about. I'm going to open the floor now to any motions from the committee members.
Before I make a motion, I want to make sure that we all understand the decision that we're making today. Because I've gone back and read the DESE recommendation multiple times, as well as the procedures with regard to COVID-19 instances. And I'm concerned that we're not reading the documentation correctly. Because when we go back and we look at the DESE recommendation, and right now I think we're operating on this assumption that like, well, an option is to adopt DESE's recommendation. That's not an option, because DESE and the DPH strongly recommend all students in kindergarten through grade 6 wear masks when indoors, except students who cannot due to medical conditions or behavioral needs. DESE and DPH also strongly recommend that unvaccinated staff in all grades, unvaccinated students in grades 7 and above, and unvaccinated visitors wear masks indoors. So this is what they strongly recommend. This is not a policy.
That's correct.
This is not even a plan. This is not a procedure. So if we say, okay, we're going to vote to accept this, we're not accepting anything. What the governor has left in the hands of the individual school districts is the decision to figure out how we are going to make this happen. They're strongly recommending, hey, we got to figure out a way to make sure all students K through 6 wear a mask. And we got to figure out a way to make sure that unvaccinated people of any kind are wearing a mask. That's what DESE is saying. There, at no point in this document is DESE saying you have the option to let parents choose.
And I guess the way that I'm reading it is the option, you're correct. One of the options is tonight is we're really deciding what route to go down. Either we're going to follow recommendations. It is not a policy. We would decide to follow DESE's recommendation. DESE has the ability and the opportunity where that language could be different. DESE has the ability to mandate that it's not a recommendation, that it would be a mandate to all the districts to do this. Then we'd have to make a policy for that. If we decide to sort of turn that into a policy and determine that we're going to make a mask mandate, then we would have to create a policy. The challenge, just to let, I guess, information that I got yesterday on a call with our legal counsel, is that DESE, a little wrinkle into this, there's, as we know and we've heard, there's a number of districts that have decided to actually issue a mask mandate. Our legal team has reached out to DESE and asked them, what happens if somebody doesn't follow the mask mandate? In the MASC sort of suggested policy that they issued, the ramification of somebody not following the policy was that the child, they would have a conversation with the parent, and if they didn't have an exception, the child would be sent home. DESE has indicated verbally to our legal team that they are not going to allow districts to do that. So if you have a mandate that you go through, and if you implement that policy right now, DESE needs to clarify that. Right now, they've told the legal team that they will not allow districts to send people home. So now you have a mandate with no enforcement, which basically turns into the DESE recommendation. It's in any decision that we make tonight. I want to make sure everybody, and I think it's a great question, Pam, because it's like, what are we deciding? I think everybody's in agreement that really this is not a decision that should be made with these 6 people. We're not medical experts. I've been a physical therapist for 30 years. I've got staff that work in skilled nursing facilities. We've lived this, but we're not the experts in this field. The state has the obligation to be able to make this decision. The governor has not issued a mask mandate. DESE has not issued a mask mandate. They've issued a recommendation. Some districts have gone and taken that next step, issued a mandate, created a policy, and now DESE is not clarified whether they're going to actually even be able to do it. So I know we don't have 8 weeks before school starts, but we do have the ability to call another special session within 48 hours. As we've seen in the spring and as we've seen throughout this entire pandemic, data and information on the ground changes almost daily. I had a conversation with Tammy Spencer yesterday about this. I said, what's the Department of Public Health in Southwick saying? They don't have a recommendation yet either. They're meeting at 7 o'clock. It may come up at their meeting, it may not. The one thing she did say is not really about the mask, but she was actually telling me that the district did a phenomenal job at last year that mitigated the spread was the mitigation systems and the identification systems that we set up in the district to quickly identify, trace who was affected, get them tested, and it significantly limited the transmission that we had in this district. Everything that we've heard so far, and what the super, and she can certainly jump in right now if you want, we are already working on those mitigation tactics again at every one of the schools. And I know we mentioned this a number of times, what happens if we do get somebody with COVID? We just got a letter back today from, I can't remember the name of the company. CIC. We just got approved for a rapid test machine or system to be able to be here at the district. And the policy that they do have is if we do have somebody that gets diagnosed with COVID, that any close contacts, whether it be 3 feet or 6 feet, no matter what we're doing, they would still have the ability to come to school as long as they were tested every day. And if they were in close contact, they would then have to wear a mask for that. But they could still have the ability to come to school. The numbers on the ground are changing all the time. if we decide to do a mandate, the challenge I've got with this is even if we did it, DESI's not clarified whether we even be able to enforce it. If we decide to follow the DESI guidelines, we are by no means indicating to anyone that we don't think you should wear a mask or that you shouldn't come. We're just not mandating it.
And I think the committee needs to be clear that if we decide to do that,
Yeah.
that our job is not done.
Oh, I don't disagree with you.
Because we still need to figure out how we are going to make this language happen. And sadly, that is our job.
I feel like we can't make someone wear, like, you can't
Well,
make someone who's
we have to figure
unvaccinated
out how we're
wear
gonna
it.
follow
though.
this language.
Well,
But I feel like if we're gonna make an unvaccinated person wear it and not a vaccinated person, you're separating them and making like, people make judgments.
I agree with that.
And we shouldn't,
Now, I have a
we
question
shouldn't separate them.
for Amy. My question is, do we have any new information with regard to the results of this parent survey, or is the data remain the same? The one that went out, that, remember we on,
Yeah, we had a couple
on
of
Monday
days
night, it
left.
hadn't.
I didn't print it out.
Okay.
Yeah, I did. When I look, Pam, I think it's all, I mean, it's,
So I
we
had
got
a,
a 40-40 type, 15 type. set.
so I had a thought about that as well, because I was thinking about that, and I realized that on Monday, when we were looking at that data, that I feel like I may have interpreted that data incorrectly.
Okay.
I interpreted that data as close to an even split between options 1 and 2. And that option 3 was not a favorable option. But then when I thought more about it, I realized that option 1 was that 43% of respondents were in favor of mandated masks for all.
Yep.
Option 3 was that approximately 16% of respondents were in favor of mandated masks for K-6. So that really,
K-6
rather
are
than
just
looking at them as
unvaccinated
1
people.
versus 2, 1 and 3 are both a version of a mandate. So if we want to talk about a mandate or not a mandate, we also need to keep in mind is that, okay, if we're gonna decide mandate versus no mandate at this point in time, then mandate and those that responded in favor of a mandate is taking option 1 plus option 3 and adding them together. And when you do that, then that poses a significant majority.
I think option 3 was anyone that was
I was gonna
unvaccinated.
say it wasn't grade specific.
Yeah,
if I
it wasn't
remember.
K through 6.
Okay.
I
No,
mean,
no, but
K
it-
but it's
K
the
through
same
6
thing,
isn't-
because K
well,
through 6
except
is
there are gonna be
unvaccinated.
unvaccinated people at the
So
high
it
school
is the
level.
same thing.
Yeah, no, absolutely. And I don't disagree with you. The decision we make tonight, and I believe the mayor of Westfield said the same thing at their meeting a couple days ago. Just because the decision we make tonight is probably not where this will finally end up. The governor may have to get involved with this. DESI may clarify it. I mean, DESI's going to be forced to clarify their decision. And I think from our perspective, to prematurely mandate something that we already know is not going to be able to be enforced is a waste of our time right now. That doesn't mean that the state or somebody may not take this out of our hands anyway. But a decision tonight to follow the recommendation of DESI does not end this discussion. And if we're going to need to monitor and see what's going on. And I have a feeling that there's going to be something else from a state perspective. And I see the superintendent nodding her head in agreement that there is going to be something that we've got 2 more weeks, almost 3 weeks before this hits into effect. So we need to do a motion at some point, either if we want to do a motion to follow DESI's recommendations and we take a vote, or we do a motion to mandate the mask and take a vote. One of those is going to need to win, and then we'll follow on that. But I can't do anything unless we have a motion. So-
This is Pat. Can I just say a couple things? before
Yes,
we
Pat.
Move on to motion. Okay, first off, I'm remote. I'm sorry for not being in person.
Can everyone hear
I
me?
want to say thank you to the parents and the audience for your participation and your heartfelt contribution to tonight's effort. And again, on Monday, and all of the emails that we have received, all of the personal phone calls and text messages that have gone out. Pam, to you, I commend you. I feel very strong with everything that you had said. I feel the same. Rob, I agree with the DESI, suggestions. However, I don't like the language. I don't feel comfortable voting on something that is really uncertain. I'm not comfortable with a mandate. I think that we need to have more information and make a decision based upon, again, the facts that you and we all think are going to come from the state, that are going to come from our own town, that are probably going to change whether we have a vote or not tonight. I don't feel comfortable. I'm speaking on my behalf as a father, as a committee member, as a friend to many parents who have children in our town, our district. I would be lying if I told you I was comfortable right now. I am not. I think that we have so much information in front of us, and I think that we need to make a intelligent effort to decide to move on and have a special meeting. I really don't think that we can decide tonight. That's my opinion. However, majority rules. Sorry, I have a dry mouth. So that's just my 2 cents, and that's all I have to say right now.
So the suggestion there is to essentially
Defer.
to a later date.
And Pat, I mean, if a motion does come up and you do not feel that you want to vote either way, you can certainly abstain from the vote.
Okay.
So if I'm understanding correctly, the suggestion is to defer until the state comes out with additional guidance, additional requirements.
Well,
until we get it.
I would like to see what the town of Southwick comes out with tonight. They have their meeting. We don't know if that's at 7.
Yeah, I mean, in speaking with Tammy yesterday, Pat, I don't believe the Department of Health will be making a decision tonight. It may come up in their meeting. But I don't believe there'll be any decision made out of Tammy's meeting tonight. And there's even, in a call that we had yesterday with legal counsel, there is even a significant question as to whether the Department of Public Health even has jurisdiction over the schools. Is that a fair representation, Superintendent?
It is.
It is.
Raise a point
It's just-
that we did speak with legal again, and I forwarded Chairman Stevenson the latest email from our attorney. We are anticipating, I've spoken to a few superintendents of the area. The president of the Superintendents Association reached out personally to DESI today, and we are anticipating getting updated guidance. I'm not sure what that is going to be, but we are anticipating getting some clarification on this guidance from DESI around the enforcement of mask wearing. Chairman Stevenson is correct, per our legal advice yesterday, that any mandate above what DESI recommends right now may not be enforceable. So they are urging the Department of Elementary and Secondary Education to clarify their stance on what strongly recommend means, because they're putting local boards of health and local school committees in positions to make a decision that truly should be made by the medical experts, and putting them unfairly in the middle of this. So we are anticipating getting some updated guidance. We don't have it yet. As soon as I get it, I send everything to Chairman Stevenson, and so he gets it in my time.
Yeah, we just got that today.
Okay, so now the way I'm seeing this is that we can vote we need to accomplish something tonight, guys, okay?
We have to get something out for you.
I'm just gonna put that up there right now.
We're gonna get a motion here in a couple
We're
minutes.
2 weeks away from school.
Right.
We need to accomplish something. So the way I'm seeing it right now is we can either not move forward with a mandate and simply wait. Now,
That's not a decision. That's not a vote.
correct. Now, I spent all of last year waiting to hear from the Department of Education and the governor, and likewise. I've been there, I've done that. I don't want to do that again because I've seen how that plays out. The other option is that we could put into effect some kind of requirement with the stipulation that we simply revisit it every single month. Because from where I stand, it's always, and I'm not just talking about masks here, I'm just talking life in general. It's always better to be safe than sorry. So if we were to require masks right now, in hopes that please give us some clarification, please let's revisit this, because I don't want to wear a mask any more than anybody else does. That please give us some guidance, then we revisit it a month from now, and then another month, and then another month, while looking at the vaccine rates, while looking at the.
So are you saying you'd like to vote for a mandate for masks now, and then it would be revisited in 30 days?
Well, we could, like, I feel like we could do that.
We could also, I guess the alternative to that would be follow the DESI recommendations right now and revisit it.
But that doesn't get us anywhere.
Well,
That doesn't affect,
But without, right,
let the school officials figure out what happens next.
but without DESI's clarification on the mandate, that doesn't get us anywhere either. So, and really, I think those are the two options.
Okay.
And I don't think anybody, no matter what we pick tonight, half the people out here and half the people listening and are gonna be upset with what we're doing. So we're in a no-win situation here. So I need a motion on the floor for something.
I still have more to say. So before I do
Well, I
that,
need a motion and then we can discuss.
okay,
But I need a motion and then I need a second. If I don't get a second, then the discussion's over and then I'll entertain another motion. But we've got to get a motion on the table.
okay, I'm gonna make a motion that we discuss the creation of a mask policy to be revisited every month, or when new information becomes available.
That's just a discussion of,
Yeah,
we
okay.
actually create.
Yeah.
All right, so how do I have to say that?
Would you?
Come on,
let's do this.
motion for a
Let me see if I-
mask
let me see if I can paraphrase this. Would you like to institute a mask mandate now and revisit it in 30 days?
Yes.
Okay, so I have a motion on the table for a mask mandate with a revisit in 30 days. Do I have a second?
Or when new information becomes available.
We can add that. Do I have a second to that? Okay, without a second, that motion's not moved. Do I have another motion?
I motion that we don't put in a mandate and that we wait for more guidance in the time that we have. But currently, I'm not comfortable putting in a mandate when we have holes in everything that they've given us.
Okay, so is it the basic, let me paraphrase this. You tell me if that's right. You want to put forward a motion that we follow DESI's recommendations at this point, that we strongly urge people to wear a mask if they're unvaccinated, to wear a mask, exactly the way that language is written for DESI.
Absolutely.
Okay.
And I would just say that.
Revisiting it
Yeah,
is a
I think
given.
there's.
Yeah, we will
it's gonna
revisit. it.
happen.
DESI will change.
Yeah.
Just-
Yeah.
We're gonna have to revisit this. I don't think, so do I have a second to following DESI's guidance?
I second.
Okay,
Second.
third. Okay, so we got a third.
We got many facts.
So At this point, we can open for more discussion at this point. I honestly don't know whether we need it. But if anybody would like to discuss that option further, if not, we can move forward with a roll call vote on that option.
We don't need further
Okay.
discussion because, wait, let me finish.
Well, that's a discussion, but go ahead.
Yeah.
Because I can see that minds are already made up. However, because I believe that it is my duty to express what I believe is right, I have a statement that I would like to make intended for your voices or your ears before you make your vote.
You have the floor.
I have to admit that I cannot believe that we're going through this all over again. Back in April, when the vaccines were becoming widely available and students were returning to school full time, I thought that we were finally putting COVID behind us. Sadly, that's not playing out. Although we've enjoyed a brief respite this summer, and the state of Massachusetts boasts one of the highest vaccination rates in the country, that is not true in this community. Not enough folks have stepped up fast enough, and as a result, we have allowed this virus to do what viruses do: reproduce and mutate. Science has not failed us. We have failed science. And now, as we bring students back to school and summer turns into fall, we are faced with a highly contagious variant among a largely unvaccinated population, and all of last year's health and safety mandates have been lifted. We know how this is going to play out. We're watching it happen in other parts of the country where school has only just begun. This is, however, avoidable. We might not want to do it, but we know what needs to be done. We must actively advocate in favor of vaccination for all eligible staff and students. We must require masks for all staff and students, regardless of vaccination status, until local vaccination rates have gone up and percent positivity rates have gone down. We must ensure a social distancing of at least 3 feet whenever feasible, and continue robust hygiene and sanitation processes. We know that we cannot escape this virus, but we can't ignore it either. These combined mitigation factors are the best that we can do to keep our students and staff safe and in school. With regard to required masking for all, I get that no one wants this. I don't want it. I mean, isn't that why we got vaccinated, in part to avoid having to wear a mask? Yes, but let's consider the logistics of the current situation. Best case scenario, students are going to get sick, and school staff and public health officials will be tasked with identifying close contacts and implementing quarantine protocols. DESE and DPH have recently released the revised protocols for responding to COVID-19 scenarios, which includes the definition of close contacts and specific instances in which a close contact is exempt from testing and quarantine. In the case of close contacts within the classroom, this exemption only applies if both individuals, the positive case plus the close contact, are masked. Furthermore, if we participate in the new test and stay program, which this committee seems to support, close contacts are allowed to remain in school and do not have to quarantine if, among other criteria, they are masked at all times. And then, of course, anytime there's a symptomatic individual or a presumptive positive case, that individual must be masked immediately and further action taken. The list of specific instances in which an individual, vaccinated or not vaccinated, is required to wear a mask goes on. My point is that if we do not require masks in school for everyone, who becomes responsible for tracking and enforcing these specific cases? That is unfair, unnecessary demand to place on our administrators and teachers. I understand the importance of personal freedoms, and I will always advocate for parents being actively involved in decisions affecting their child's education. I also understand that masks can be unpleasant, impede social interactions, and in some cases may even interfere with the learning process. I agree. But let's be honest, illness absences and remote learning are a much greater disruption to learning. No parent, no student, no educator wants to relive last year all over again. This is not about personal beliefs or political ideologies. This is about providing the safest, most equitable, in-person learning environment for our students. As school committee members, that's our job. The following organizations are now calling for universal masking in schools for all students and staff. The CDC, the American Academy of Pediatrics, the Massachusetts Medical Society, the Massachusetts Teacher Union, and most importantly, the Massachusetts Association of School Committees. If we ignore the pleas of these professional organizations, we are blatantly disregarding our responsibilities as school committee members.
Thank you. All right. We're going to call a vote to follow the DESI guidelines. A vote for yes would be to follow, a vote against would be not. We're going to do a roll call vote because Pat is driving in an undisclosed location in North Carolina. So I'm going to start Pam.
Yeah.
Ted,
Yes.
John,
Yes.
Ryan,
Yes.
Pat,
Yes,
and Rob is a yes. So the motion passes 6-1-0 or 6-0-1. 5-0. There's only 6 of us, sorry. 0. Okay. That ends the action items. Now I need a motion for adjournment.
Motion to adjourn.
Second.
We'll do a roll call vote to adjourn the meeting. Pam,
Yes.
Ted,
Yes.
John,
Yes.
Ryan,
Yes.
Pat,
yes.
and Rob's a yes. Motion passes 6-0-0. Thank you, everybody. Have a great evening.
I still have it with 1 week. Give it 1 week.